And I always wanted to be good in my classes. I never wanted to be the best, but I wanted to be right up there. So I worked hard.
To see this graceful Southern lady surrounded by the pictures of her family and memories of her life, you wouldn't know she's a shero in her own right. More than 50 years ago, this quiet woman with a calming presence broke a barrier in public health that allowed others to move forward. But long before that, the girl who loved to play basketball dreamed of going to North Carolina A&T on a scholarship and becoming an artist. But growing up in the South in the 40s and 50s, her mother gave her a dose of cold reality.
But my mom said, you, and I know why she said, you cannot make money as an artist. If you go to nursing school, I'll help pay for it.
She worked at Charlotte's segregated Memorial Hospital during high school. In 1956, she got her nursing degree at St. Augustine's College in Raleigh. Coming home, she worked for Mercy Hospital in a wing for black patients and taught nursing arts at the all-black Good Samaritan Hospital, where others told her, try the county's health department. But there was a catch.
At that time, in order to be hired by the Mecklenburg County Health Department, as in other agencies, someone who was your race had to retire or die.
It was no effort to increase the number of black people who worked. It's somebody else had to die
or
for you to get in.
For me to get in. And that's exactly what happened.
So began Madie Smith Moore's journey in public health, knowing that her work and her impact were being closely watched.
I knew that whenever there needed to be something done and no one was doing it, I would volunteer. From that time on, there was a lot that was offered me. The opportunity to go to UNCC, to become a certified child health specialist.
She was Mecklenburg County's first certified child health specialist in the early 70s, assisting doctors in clinics and schools. But it didn't come easy or without confrontations.
There were attempts at sabotage, and I even considered getting an attorney. But I always tried to keep my cool. And it was hard not to become hurt. And oftentimes, if I cried, it was after I got home from work or in my car at lunchtime. And then I would put my powder puff on and go right back to work.
Yet for this quiet woman who would simply straighten her crown and go on, being first was not her goal.
It was just important to have a good job, to be able to do things for my children, send them to daycare and know that they were taken care of. That was what was important to me, and to try to be a good wife.
She went on to become the supervisor of the North team, covering child health clinics. Ironically, her next step up came after the death of the program supervisor.
I was not paid, but I was really the program chief for the Charlotte Mecklenburg Child Health Program. And I just happened to be black.
She remained in that role until retirement. For those following in her footsteps, words to keep going and achieve.
I encouraged them to go get their graduate degrees because I knew that that was going to be their best opportunity. I did not have a graduate degree at that time, but it was going to be their best opportunity to ever get to where I was.
And for that young girl who wanted to be an artist, well, she's now in the 9th decade of her life, a proud mom and grandma. And more than a decade ago, the widow found love and marriage again with retired NBA Warriors champion player Jackie Moore. So how do you summarize such a life? In Miss Madie's words, very simply.
I am grateful. I feel blessed, and I thank the Lord.
There's an old spiritual that says, "May the works I've done speak for me." For Mrs. Madie Smith Moore, they speak loudly. For Carolina Impact, I'm B. Thompson.
We hope you enjoyed the story. If you don't want to miss any more great stories about the Charlotte region, please subscribe to our YouTube channel.